Hi everybody, we're going to get started now, and as we've said, it's being recorded, so you'll see that up the top. I'm Rachel Duke, I'm Charity Director at Heads On, and we're running the grants programme on behalf of the Mental Health Collaborative of the Sussex Health and Care Partnership. So I'm just going to give a really brief overview of where the GROW funding programme sits within the context of a wider piece of work that we're doing, and then I'm going to hand over to Rachel Blair, who's Grants and Programmes Manager at Heads On. She's going to talk through the funding, answer questions, and she'll cover a kind of brief bit of housekeeping at the beginning. We're conscious that some people here might only be interested in one of the funding priorities, so she'll also at the very beginning talk through the order of how she's going to do it and how she's going to do questions. So if you only want to listen to one part, you'll be able to do that. So the GROW funding programme is part of an overall £600,000 grants programme that we Heads On are running on behalf of the Mental Health Collaborative of Sussex Health and Care Partnership. The other programmes that we've run and are now closed were Innovate and Build, and both of those were for project funding for service delivery. So Innovate, as you would expect, does what it says on the tin, was for pilot funding, and Build was to grow and scale existing work where there was an evidence base of success. Sorry, Build for evidence base of success. The funding was set up through kind of various pieces of consultation, and also in response to recommendations from the NHS long-term plan, which many of you will have seen, which talks in detail about partnerships with the voluntary sector, as does the advent of integrated care systems and integrated care boards. So as part of that work, the Mental Health Collaborative did a piece of consultation with the wider voluntary sector across Sussex a couple of years ago. Some of you were very involved in that work, and it was led by a lady called Di Bardwell. And the GROW funding programme responds in part to recommendations that the voluntary sector made in Sussex through that piece of consultation around the need to invest in the growth and development of the voluntary sector itself, particularly organisations who were delivering within a mental health space. So that's what the programme is designed to do, really. Obviously, Sussex is a really big place with a very active voluntary sector. So we are aware it's not a huge funding stream, but it is a funding stream and it is available. We're really pleased to at least have this opportunity, and hopefully if through this work we can kind of prove and be able to evidence that investing in that voluntary sector infrastructure actually has an impact in terms of service provision and improved offers for people who might need mental health support, then that's a really positive thing for us to be able to do in terms of looking to the future and what we might be able to offer kind of later. So there's two different funding priorities within it. One around the kind of wider development of the voluntary sector, and one which is specifically recognising and responding to some of the challenges that minority ethnic-led groups in Sussex can face. So at that point, I'm going to pause. I'm going to hand over to Rachel. We will both be sort of sat here in the background and happy to kind of answer questions and things as we go. So thanks very much for joining this morning.
Hello, good morning everyone. Okay, thank you, Rachel. So I'm going to talk about priority 1 first, and then priority 2. So if you're just here for priority 1, you're very welcome to drop off the call after we finish that part, but there will probably be some general questions at the end, so it might just be worth bearing that in mind. The webinar is recorded, so you can always pick it up again at a later date. So for priority 1, we have £75,000 available for organisations who can evidence a track record of delivering activities that support the mental health and wellbeing of their communities. So for priority 1, we anticipate making up to 2 grants at the maximum grant, which is £20,000, and then smaller ones. The smallest grant available is around £5,000. So it's just worth bearing that in mind, and thinking about what you could do with £5,000. You know, how much impact could you make with that? Because we were sort of looking at it in that way, to only make 2 at the maximum grant available. So to be successful in applying for a GROW grant, you must identify a clear development need and evidence that this cannot be met with your existing reserves or existing funds. So with that in mind, we've been looking at organisations who if an organisation has a high turnover and significant reserves, would be expecting this sort of work to already be part of their business development plan. So this is for organisations where that isn't the case. So a GROW grant can fund organisational improvements, leadership and governance development, improve systems. In our guidance notes, there's a full list of examples, but those are just some of the things that we would be looking at funding. So I've got my notes here, so I'll see if you keep looking across just to double check. So it'll be around developing, as is in the title, so improving things, developing things, putting you in a stronger position. So it might be to support you around being in a stronger position to attract future funding. It's about capacity building and development. So we'll be awarding grants to organisations that meet the eligibility criteria and identify clearly how this piece of work will enable them to grow and how that piece of work is sustainable. So it's not sort of a one-off project, it's something that's going to impact your organisation going forward. So it might be development and monitoring systems, it might be investing in new software, working with consultants, maybe working around something like a fundraising strategy or something that gives you that development opportunity going forward. It could even be around development of a new role, but we're probably thinking about the funding limits available. It most likely you'd need to match fund that depending on the role. So there's lots of things to think about, lots of opportunities, but it's just about being really, really clear what the need is and evidencing that that's something the organisation isn't already in a position to be able to fund. So we really, really want to see specific outcomes with this fund. These are fully detailed in the guidance notes, and I would encourage you to read through them with a cup of tea and a biscuit and take it all in. So they would include things like improved activities and services, these outcomes, improved structures and systems, or improved communication. Some of those things will be outcomes of the piece of work that this fund will be funding. So in terms of eligibility, which I know is always the key thing when you're looking at can I apply here, we are only going to fund organisations who can evidence a track record of delivering activities that support mental health and the well-being of their communities. So we're only funding organisations whose core business is mental health, and by that we mean at least 50% of your organisation's activities must respond directly to mental health in your community, so mental health outcomes for people with mental health problems. So as mentioned, we only fund organisations that can evidence they can't already fund this. So if you maybe in receipt of multiple commissions already, we'd expect this to be part of your planning work already for your organisation. We say that we'll only fund project management costs up to a maximum 10% of the total budget. So it might be that you, for 10%, it might be you have an overall piece of work and this funding is going to contribute to part of that. So it's 10% of the total budget. We will not award grants that make up more than 20% of your annual turnover. And we will be doing a financial viability assessment on all applicants. So this will mean you need to make sure you have things in place like 3 years of accounts or be able to provide 3 years of bank statements. Okay. One of the questions we anticipate will be that around previous recipients. So obviously this is the third funding round in this pot of money. We will fund previous recipients and anybody who's been previously rejected. If you're in receipt of a grant already, it just is worth bearing in mind that our priority for the overarching grants programme is to achieve a spread of funding across Sussex, and that is something that we would bear in mind during the assessment process. So it's just worth thinking about that. Are you delivering, well, it's not a project, so it's, are you working in different areas, are you covering a spread of Sussex? Just worth bearing that in mind. There's some sort of general bits in the guidance notes around applicant organisations. They must be not-for-profit. Hopefully that's fairly obvious. So we'll fund charities, social enterprises, community interest companies, and there must be must evidence clear public benefit. We would want to see 3 unrelated directors, all those sorts of normal things. Have your own bank account, have a constitution in place. So those things are all in the guidance notes, and encourage you to just have a look through those things because those are things that we need to be aware of very early on in the assessment process. So around priority 1, does anyone have a look at the questions? If anyone got any questions around priority 1, and I'm not sure if Rachel wants to add anything at this point. we're in the same office, and she's not waving at me, so
There's nothing in that Q&A box at the minute.
No questions. Okay. All right, well, there'll be space to go through, so I think I'm probably rushing. I was saying to Rachel before we started this, I haven't done any sort of presentation or webinar in a long time. It's quite anxiety inducing not being able to see people looking at you or responding. I don't know about you, but I quite like to see if someone's smiling or nodding or frowning, anything, any kind of response. So thank you, Jacqueline, that's just what I needed. Okay, so I'll talk about priority 2 now. And then, yeah, if anyone's got any questions, please do just pop them in the chat box. So priority 2, this is a grant around supporting established minority ethnic-led infrastructure organisations to work with minority ethnic-led organisations in Sussex around capacity building. So it's about that development and capacity and growth again, but specifically for minority ethnic-led organisations. We will only make a single grant of £50,000 under this funding priority, because we think that's what will have the most impact and enable that organisation that we award to make the biggest impact. The COVID-19 pandemic shone a spotlight on the inequalities people from minority ethnic backgrounds face in terms of healthcare, both mental and physical health. This spotlight was not showing something new. It's something minority ethnic communities have been battling for a long time, but it was something that was exacerbated by the pandemic, and it was the pandemic sort of heightened the awareness and conversation around that. We know that minority ethnic-led organisations can face challenges affecting change, growing, and so therefore our priority here is around supporting these organisations. So with this funding, we want to put some money into the development and capacity building of those organisations and support the work they're already doing in our communities. Those organisations, those grassroots organisations, are already doing fantastic things, but could be doing so much more with some support. From another larger organisation that's already been able to do those things. So that's what this funding pot is about. So we will fund organisations who are minority ethnic-led infrastructure organisations, and there's some specifics in the guidance notes around who needs to be on the board for that, and what we'd expect to see there. Just thinking of something more specific to say. So in terms of Rachel? Okay, so funding deadlines, our funding deadline for this is the Thursday, the 25th of May. In terms of delivery, we'd expect projects to complete, including the evaluation, within 18 months. So final projects would complete in autumn 2024. I'm just going to have a quick skim over my notes just to move. Yeah, of course you can.
I can't have my video. I'm really sorry, everybody, because Heads-On's only got what can you hear me all right? Yeah, Heads-On's only got one Zoom account, so we have to log in as the same person. So you can see Rachel, but you're going to have to listen to me. I'm really sorry. I just wanted to pick up on priority 2, just a couple of points around it, really. And really around eligibility and what that priority, the reason why it's structured in the way that it is. So there is a national evidence base that demonstrates that for minority ethnic-led organisations to survive, thrive, grow and develop, that can often work best when it is delivered by other organisations who have followed a similar trajectory and have addressed some of those challenges successfully previously. So we're looking for an organisation who's got a track record of doing that work. And that's why it's kind of structured in the way that it is in terms of where that infrastructure development work is, where we're looking to commission it from. We are conscious that some of the minority ethnic-led organisations in Sussex can face challenges, particularly in terms of being able to access commissioning money, for example. So actually being able to access NHS funding. And at the same time, that kind of structure of organisations, they are the ones who can have the greatest impact in their own communities. So there's a mismatch really between the expectations of the NHS and the needs and desires to improve health outcomes for people. And at the same time, some of the structures that we use within the NHS don't work well. So to kind of bring that together, that's one of the things that we're looking to try to achieve. is to build some of those bridges and address what some of those barriers might be for different organisations. We are really conscious that the funding we have available is quite limited, so we're not expecting that every single grassroots organisation in Sussex, for example, would be able to be supported with that. So we've set some parameters around the kind of size and scale of what we think is possible, but we're also really hoping, again, that by doing that in a small way in Sussex, it can start to build something that we might be able to grow and develop if Heads On and other NHS organisations are able to access more funding to support that. By no means for us to do the work, but to be able to fund it to happen. And that's kind of where that's come from. I'm really happy, with Rachel to sort of take questions on that. But just wanted to give a little bit more background, really. And the other thing to just touch on in terms of eligibility, particularly around mental health, which I think will straddle both, but for particularly priority 2, we do recognise, like in all healthcare, we, as any of us who use the NHS in the street, don't really care about the distinction between mental health and physical health. It is our health. And so actually we know those grassroots organisations that we're talking about in terms of wanting to work with and support will sit across both of those things. They will be just grassroots organisations embedded in their communities, not necessarily with a specific focus on mental health or physical health. Priority 1 is where that starts to look a bit different, because actually that is about organisations whose core business is working within mental health care. That's partly because we've got a very limited funding pot available. There are lots of organisations, for example, all arts organisations, who deliver fantastic projects that work in a mental health space, but their core priority is arts. And actually, with a small pot of money where we know we can have limited impact, we want to focus on those organisations whose core business is mental health. So I hope that's just a bit of useful clarity in terms of some of the eligibility criteria. Please, if you've got queries and you want to kind of pick us a bit, pick that up a little bit more in detail, do pop that in the Q&A. Thank you.
Brilliant. Thank you, Rachel. I'm not sure we have any questions so far. Hopefully it's working for everyone. So in terms of where we'll fund organisations which benefit communities in Sussex. With priority 2 in particular, we understand that the organisation that delivers the work may be based outside of Sussex, but the work and the beneficiaries must be within Sussex. And so for priority 2, we'd be expecting to see a maximum of 5 organisations or 5 beneficiary organisations being supported by the organisation that has been awarded the grant. But that work must be in Sussex, even if in priority 2 that organisation is sitting outside of Sussex. So we won't fund NHS provider or statutory agencies, won't fund individuals, political activities, that sort of thing. All these things are in the guidance notes, so please have a look. And we won't fund core costs. So this needs to be, separate to that. It needs to be about development and growth. So I mentioned that the deadline for applying is the 25th of May at noon. So please send it to us on time, because we won't be looking at anything that comes in after that time or date. To apply, it's really simple. There's an application form on our website. You just need to submit it via email to our grants at Heads On email address. And please include the links to your financial accounts with the application form. So then we can make sure that due diligence around the financial viability is done really quickly. And so we can sort of get the assessment process moving. In terms of reporting requirements, I had a question about this morning. So we together, if you're successful in your application, we work together to put together a reporting schedule, and we'll look at key milestones for your project, and just report on those and work on that together. Payment of the grant will be linked to meeting those key milestones, and all projects will be required to submit a report at the end of the project, so in that autumn time. And depending on the project length, we may look at quarterly reports, but that's something we'll discuss with you if you're successful in your application. Just thinking of something else to share this morning. We aim to notify you within 8 weeks if you've been successful. Yeah, does anyone have any questions? I feel like we've whizzed through this a little bit quicker than I was anticipating. No, it's a very quiet. Oh, can you reconfirm the date? Yes, so it's I'm going to double check now in case I said it wrong. 25th of May at noon is the deadline for applications. And if anyone's got questions around their specific project, please do get in touch and we can talk to you about that.
Someone's put a question in the chat, Rachel.
Yeah, that's about the date.
No.
Oh, a question in the chat, bear with me.
It's in the chat box, not the Q&A.
Okay, so I'm just looking through the questions.
They're talking
Yes,
about reserves.
I think Rachel's going to come back to you, Aaron, just on that question. So Aaron has asked, when considering applications for priority 1, you mentioned significant reserves. Please, can you say more? So the Charity Commission advises a minimum of 3 months running reserve. And Rachel's going to come back.
Thanks, Aaron. Yeah, so the reference Rachel made to reserves, one of the criteria that we have said for priority 1 is that we are the funding is directed at organisations who wouldn't be able to invest in this kind of growth and development work themselves. We wouldn't expect, obviously, if you provide core service delivery, for you to be needing to tap into that to be able to deliver this. So in terms of Charity Commission guidance, that's not really what we mean. It's more that what we tried to avoid doing is using turnover as an indicator of whether or not we consider you to be eligible, because it's not always the best indicator. Sometimes that turnover can be very specifically restricted and actually would not be able to be used for something like this. However, if as an organisation applying, you have very high turnover into the millions, you've got healthy reserves, and you are in receipt of commissioned contracts, we would expect that as part of running an organisation with that kind of turnover and that level of scale and delivery, you should be having core business planning in process. You should already be doing this kind of work, and you shouldn't be needing to be applying for a grant to be able to do that. If you are a small organisation, you've got your restricted reserves that they're in place of any kind of immediate catastrophe, so that you can continue in the short term to deliver your immediate service provision. And also if you needed to go through redundancy processes for staff and what have you, no, that's fine, and it wouldn't preclude you from being able to apply. But I think you probably can kind of figure that out really in terms of size and scale. You need to be able to evidence that you can't apply for that, you couldn't fund it yourself. You've said helpful, thank you, so I think I've covered it. But if there's anything else you need, do say so here, or if when you're actually doing the application, if you've got questions, then you can kind of include that. The other thing I wanted to say about eligibility, on that though, we really would like to see applications of all sizes. We've said we'll only do 2 at the maximum amount. So actually, I would just urge, whether you're here today or watching this back later, we want to see a range of sizes of applications. And also, if you are at the kind of larger end and you could match fund it so that it maybe would have greater impact, we'd really welcome seeing that as well. We don't have to be the only funder of this kind of work. And it might help your chances of a successful application, because we think we're going to get a lot. There's nothing else available around this space at the minute locally. So we're kind of expecting to be inundated. So the more things organisations can do to kind of demonstrate their own commitment to growth, development, so on, I think is a bonus. Thank you.
Might be worth saying at this point as well around joint applications. So for priority 2, we would accept joint applications, so collaborations between VCSE partners. There's no limit to the number of partners, but we would be contracting and we'd expect the application to come from the lead partner, and that lead applicant must meet all the eligibility criteria. In terms of priority 1, we're not accepting joint applications, but if there's a piece of work that you want to do sort of in partnership with another organisation, please apply individually and reflect that in your application, so we know that that piece of work will be being done together, and we would award separately to those organisations. Yeah, so in terms of partnership, we're just looking at priority 2. Has anyone else got any more questions this morning?
Do you want me to talk about the overarching strategy for mental health or not? You have to turn yours off to do that.
I'm just going to pass back to Rachel, who's just going to give a bit more of an overall view, and just give you a chance to think about if you've got any questions this morning, because this is a really good time to ask them. But obviously you can get in touch with us at any point to ask anything. We've got, I think it's another 5 weeks till the application deadline, and it might be that some things come up then. So please do get in touch using the grants inbox so we can come back to you.
Sorry, I am here. Rachel's trying to enable me to put the camera on so you can see me, but it's not working. So I'm just like a voice from a dark screen. So sorry. I'll try it one more time. No, it's still not working. Never mind.
Done it.
Oh. There you go. I'm not sure that's an added bonus, to be fair, but there you go. So I was just going to kind of give a few tips in terms of actually filling out the application forms, really. So we've given you quite a lot of detail in the guidance notes about what we're looking for and the kinds of projects that we will consider funding to kind of maximise your ability to score well. I think I would urge all of you, irrespective of whether you're looking at priority 1 or priority 2, to think about the piece of work that you want us to fund in the context of your wider organisation and your wider business plans and strategy for growing, developing and moving forwards. And also where your organisation sits locally, both within the voluntary sector, but also in terms of partnerships with NHS services. This funding, the overall funding that Heads On is managing, is part of the community transformation programme in Sussex. So that's the transformation of secondary care NHS mental health services and how that is shifting and growing and developing to support people better in the communities that they live in a way that works for them, so that it is more responsive and more flexible and more kind of centred around those people and what they might want. If you are able to cite your development work within that, so just remember to kind of talk to us about what your organisation does and how embedded you are in your local communities and how linked or not you are to the kind of community transformation programme. I think you'll score more highly when it comes to that assessment process. And also, it sounds a little bit maybe obvious, but when you're thinking about us doing viability assessments on your organisations, the funding we've got available isn't crisis funding. So it's not like the kind of money that was made available by various national bodies at the start of COVID, when organisations were in real crisis and everybody's income kind of did that. This is about growth and development. So you will need to be able to demonstrate that you've got a kind of stable base from which you want to go and how you want to use our money to support further growth, if that makes sense. I think it's unlikely that this money would support crisis type activity, and the guidance notes kind of make it clear that that's not really what we're looking to do within this funding round. So Rachel, I know, will in a minute put in the chat the email address for further kind of queries around that. And I think she's going to talk a little bit. We do some FAQs and we will update those with anything that kind of comes out today that we think is maybe missing or hasn't been, kind of covered in that sort of detail. Does anyone have any questions on the bit that I've just said? I can't. There's nothing in the Q&A and there's nothing in the chat, so I can only assume that the guidance notes are very clear. So I'm going to probably hand back to Rachel, and then I think we'll wrap it up. If there's no queries, so we won't keep you. We'll give you about half an hour of your time.
Thanks, Rachel. I think just to emphasise that this funding stream is non-recurrent, so please apply now. Think about how you can use this, and please apply now, because there isn't another opportunity to share this funding for this purpose. And it feels like a really exciting opportunity to be able to grow and develop. So I'm really looking forward to seeing the applications. So yeah, if there are no more questions this morning, we'll wrap it up. It's nice to get half an hour back. But yeah, please do get in touch with any questions, or if you want to talk through any specifics of your application or ideas around using the funding and what you think, just want to sort of check in, then please do get in touch. And yeah, we look forward to hopefully seeing some really exciting applications. Thank you very much.